Good afternoon, everybody, and welcome to today's webinar. Today's subject is protecting and promoting mental health at work during the coronavirus pandemic. I'm Anna from the TEC, and I'm joined by Fiona from PCS and Robert from UNISON. I'll be getting them to introduce themselves in a few minutes. Little fun fact, we've just discovered we're all from Kent. We discussed that in the green room before we came live. So bit of interesting trivia there for you. Okay, so just a little bit of housekeeping before we get going. As usual, we've got live captions on this webinar. Please click the green button that's underneath the video and that will open the captions for you if you want to follow along with those. It's great to see so many of you already introducing yourselves in the chat panel on the right hand side. We love hearing about who you are, where you're from, so please keep doing that and use it to exchange some tips and ideas on the subject of the webinar. There's an ask a question button at the bottom of the screen. You can post a question for Fiona or Robert there, and we will try to get to as many of them as we can after the main part of the webinar. But please don't worry if we don't answer your specific question. We do take all questions. And we use it to inform other advice that we give to workplace reps. So, protecting and promoting mental health. I think we can all agree that the past 10 months or so have been quite unique, and we've all faced differing factors that would affect our mental health, from financial worries, isolation, increased workloads, and perhaps bereavement. We've all got story to tell, really. So that's going to be the focus of today's webinar. So first of all, Fiona, can you introduce yourself, please, and just talk for a few minutes on the experience of your members in PCS during the pandemic and what factors have been impacting mental health?
Hi everyone, it's nice to meet you all. I'm Fiona Brittle and I'm a National Executive Committee member for PCS. I am originally from Kent, but ran away about as far as I could up to Glasgow, which is where I'm based now, and I work for the Scottish Government. I'm just going to talk a little bit about sort of the overall impact of the pandemic that we've been sort of seeing from our members in terms of mental health. We have a mix of our members who are, most of the departments have moved to working from home, but there are some large, very key areas where staff are still in offices and either have been since the beginning of the pandemic or have been moved back into when the government decided very prematurely, in our opinion, to start moving people back into the offices over the summer as part of their business as usual, get back to normal push. And that includes some areas like the DWP, who've been in the offices the whole time, the DVLA, and the court system as well, amongst others. And obviously some of you will know about the DVLA in Swansea, who have been one of the biggest workplaces to have a large outbreak. There are over 1,800 staff members working there, and there have been more than 500 individual cases of coronavirus. And obviously it's and despite PCS consistently demanding that our members be either removed from that workplace and working from home, or have at the very least have significantly bigger security and safety measures put in place, there's been no movement on it, and we can see our people consistently having to face every day going in to the workplace and actually facing the potential of life or death in order as a result of the government's mismanagement. So I think firstly it's just really important to acknowledge that huge amounts of the impact on health in general, but also mental health from the pandemic, could have been avoided and have been created by political and ideological decisions of successive austerity governments, including the one that we have at the moment, but ones which we've had leading up to this as well. It's important to recognise that, because it's not going to be possible to keep the system ticking over the way that it currently is and the system of wider society, and then put a sticking plaster of nice plants, yoga, going for a walk, self-care, do it all yourself, make sure that you're keeping yourself well, and sort of expecting that to make a material difference to the mental health crisis that we've been facing for years, and that has been dialed up 100-fold during the COVID-19 pandemic. Because unfortunately, the way that we live as a society and the impact it has on people's mental health is not something new. We can't divorce mental health impact on people from the wider society that we live in, with 0-hour contracts, precarious employment opportunities for people, rising rents, wages that aren't tied to inflation and actually constitute real-time wage cuts, and how people are supposed to be able to look after their own mental health when the very basics of their lives aren't, they're not being able to meet their basic needs is beyond me. So our members in the office, obviously, as I've said, are facing fear of illness and fear of death. And it's not an overstatement, obviously, to state that every day when they go in. There's the fear of passing it on to people when they have to travel into the office. And that fear and the constant cloud of that is obviously going to be contributing not just to people's panic about their physical health, but also their mental health as well. They're being told every day by their employer that the job is more important than their life. And the opportunity to save public money instead of spending it on sufficient IT systems which would allow them to work from home, again, is less, that's more important. Than saving money and cutting budgets and cutting public spending is more important than having our people, who are, by the way, key workers and who are providing an incredible service throughout this entire pandemic, which has been vital to keeping the country going. It's more important that we save a bit of money and don't properly spend the budget. It's more important for you to go in than to be safe. And it's obviously completely contrary to the government's messaging as well, stay at home. Whereas we've heard reports from, particularly in the DVLA in Swansea, staff being told to turn off the COVID tracking app so that it stops pinging and so that people can actually so that people can actually stay in the office, even though they're being told by the tracking app that it's not safe. There's obviously the fear for people of being made to go back in as well, people who were in the office who were then brought home, the fear of having to go back in. There's a lack of clarity around whether being a key worker is enough to be told to have to go into the office, and we certainly are pushing for the idea that you have to be a key worker and be in a COVID critical role that has to be done in the office. It's not enough just to say that what you do is really important if it's possible for that to be done at home, which it would be if there were sufficient investment from the employer to protect people to be able to do it from home, then you should be doing it from home. Attendance management as well is still being triggered, people having their trigger points, sometimes just through COVID-related illnesses directly having the virus themselves, but also things like being off work on stress, mental health. We have members who are being brought up on attendance management procedures during this time, and people, I think it's a universal experience of people being told to come in or lose your job in a pandemic, which again is kind of one of the underpinning purposes and tenets of capitalism, is that if you don't turn up to do this job and accept any of the conditions that we put on it, we will replace you. Someone else will do that job. Someone else will put themselves in danger. So put up, shut up. And that's what's happening. And no wonder when you have that fear, not only would you lose your wage under under this pandemic, if you were to be if you were to be let go, there is also years and years of chronic underfunding, which means that the social security system, which would be there to allegedly catch you in that situation, is not sufficient and would not be able to support you. There's also, I think, the added thing of not being able to see your mum, but you can be crushed into an office with 1,800 other people 5 days a week, or 8 hours a day, and that there is impacting people. Our members working from home as well, we've been working from home longer than we ever thought. There's the fatigue there's COVID fatigue of still having the incredible fear. It's as bad now, or it's worse now than it ever was, and it's dangerous. But now we also have almost a year of restrictions on top of that, and that fatigue of not being able to see people, not being able to connect, while also still living under fear. There's the isolation from colleagues and families and friends, which has also brought up the opportunity we've seen quite a lot for some, shall we say, creative management decisions, with people being asked to fill in an activity log at the end of every day, detailing exactly what they've been doing during lockdown, which again just contributes to this idea that workers are lazy. Workers would do nothing if they had the opportunity. No one has the sense of dignity or a job well done, and we have to be standing over you and micromanaging you to make sure that you're actually doing anything. And working from home is an opportunity to skive off, which obviously is not the case. But there's all these opportunities there for when people are separated from their colleagues, it's harder to know how other people are being treated. I think as well, just the idea of, people have to homeschool. There's now family living in your workplace. You are working in your family home. If you're working from home, trying to balance that really is bringing down the boundaries, which are really important for maintaining good mental health, as the boundaries between home life and work life, and we're always talking about that balance, has now been taken away. And that's obviously, while that's important to protect people to be working from home, it's an enforced invasion of privacy, which has to be acknowledged, because I'm constantly trying to make sure that before I rearrange my whole living room so that I'm sitting in front of a wall, I was working in my bedroom and trying to make sure that people could see my washing behind me, and I'm talking to my manager and my manager's manager, and there's my bed in the background. Not the situation that you would normally find yourself in, and one which is really uncomfortable. And actually, I wouldn't have chosen to let these people come see in my house, but now they can have a nosy round. I think as well, universally across all of our members, but probably wider as well, we in the civil service have had the insult of pay freeze as well, which again, despite the fact that we have been working at the forefront of this and working to deliver and make things tick over for people, there's a Westminster Department's pay freeze, meaning that as inflation rises, our wages will not, which means that not only is it a real terms pay cut, but also as a result of 10 years of austerity, it won't even do anything to try to restitute the fact that there have been gouges against civil service and public sector pay. So it's going to continue slipping away rather than even trying to get better and make up for that. There is also the universal strain on mental health services, which again comes as a result of poorly funded public services, which is an ideological element of this government. As well as working from home, I'm currently doing therapy from home, and I can tell you it's just about as good as working from home is in terms of recreating the real thing. It's incredibly difficult, and I even then am very lucky, because there are people on month-long waiting lists, over a year sometimes, and not being able to access vital mental health services. And no wonder that, because there is not enough funding there, and that is a deliberate decision by successive governments. So I'll leave it there for now. I have another page of notes about what to do about this, but I know that that's one of the questions that we're going to be talking about in a little bit. So that's just a little snapshot of how things have been for our members, but also just it's really important to recognise that this is not an accidental outcome from a government that tried to avoid it. This is what happens when you have a lack of public spending, when you have a lack of workers' rights being put at the forefront of policy and government agenda.
Absolutely, thank you, Fiona. And we will definitely be coming back to some of the practicalities that you've got noted there. But before we do, Robert, we've said you're from UNISON, so I'm sure that your members are experiencing mental health issues, not necessarily completely different from Fiona's, but because they work in different workplaces, maybe they impact them differently. Can you tell us a bit about that, please?
Yeah, well, UNISON has 1.4 million members working across a range of key services. We have members in the NHS, we have members in social care, we may have members in schools, and we have members working in local government, normally in offices, and now obviously many of them working from home. So we have a range of different issues. Just to go through some of those, obviously in the NHS, we have staff a wide range of occupations, but all of them under enormous strain at the moment in terms of workload. And my colleagues in UNISON branches and the health service group have done their absolute best to support them during this really difficult time. Probably in the NHS, we have probably better partnership working arrangements than some other sectors, to be honest. So there has been some joint working on some of the mental health issues such as PTSD, post-traumatic stress, which particularly affects our emergency workers quite clearly, because they, that not only are they having difficult situations to deal with, very traumatic situation to deal with at the moment, but they are almost constantly on the go. For our ambulance services in particular, is just more or less no respite. So huge issues there. There are also difficult issues for our members in social care. they have the added insecure, their mental health are added to that. Many of them have very insecure working. They are amongst the least well protected groups of workers, and I think this comes to the fore really during this pandemic. We in UNISON have been banging on about this for a number of years now, how these workers, the concerns over these workers who really were neglected, their working conditions have been eroded. They are often working on 0 hours contracts with very little job security. And those are obviously issues that add to all the mental health problems they have. And, and then on the other hand, also we have our members from schools have really, in the last few months, I don't know how they cope, to be honest, because one moment they're being asked to go into school, one moment it's closed. We have a government completely confused in its policy. We have a government which appears sometimes indifferent to the safety of our members, which is all going to impact on their mental health. Just to say that one thing I want to make clear is UNISON primarily sees mental health as a collective issue. Very often, I've always been concerned for a number of years that there's been a lot of work done by some employers on mental health, but very often this is from the individual or from an individual format, which is almost like saying this is a problem, a person with a mental health problem, and you need to know how to manage them. And that is really, in our view, is the wrong approach, because we all have mental health problems to one extent or another. And the reality is also these are work related, and to be fair to the Health and Safety Executive, the regulatory body, they actually recognise that, and they've done some work using, for many years. Some of you hopefully will be familiar with the stress management standards, which consist of employers are asked to look at the primary causes of mental health, which includes demands, control, support, relationships, role change. And, that relates to many of the points I was talking about, obviously workload, but obviously issues such as constant change and uncertainty. And that really emphasizes the importance of these mental health issues. And, UNISON has over the years, some of our branches done some really great work, just to be a slightly positive light. We had some of our colleagues from Scotland, from Glasgow City branch, for example, did some work using the stress management standards. They were able to use those to do a survey of members and force their employers to make concessions over job roles. They also highlighted issues such as bullying, all of which contribute to mental health issues. So I've just given you a very, very quick overview. One thing I would like to finish on, though, is I mentioned, that I've emphasised strongly that mental health is a collective issue, and the one thing that has come to light during this pandemic is, again, you have employers concerned about mental health issues, and I think where Fiona mentioned home working, our members, how many of our members are working from home, and as you said, they often feel very isolated and alone. But the one thing that during this pandemic, I've often said that one of the best ways in this current pandemic employers can help the mental health of members is for them to be confident that their employers are doing everything they can to keep them safe. And frankly, sometimes that is not the case. And that is why at the root of it, good health and safety is the route to tackling mental health. Thanks for your time.
Thanks, Robert. So you've raised some really interesting points there, and we will be coming back to more of the issues, especially what an employer can do and what reps can do to support colleagues in these situations and work to try and get change from management. Just a quick thing before I put a couple of questions to Fiona and Robert. My colleagues, Shelley and Alice, are posting links in the chat panel to both blogs written by Fiona or information on the UNISON website. Shelley's also posted a couple of links to information from us at the TUC that directly address some of the questions people have asked. One was about bereavement. I can't remember what the other one was. Sorry, it zoomed past very quickly. Don't worry if you've missed it, because a link to all of these will be included when we send you a link to the recording after the event. You'll get that email later today. So yeah, don't worry, we're keeping a note of all resources that are shared. So my first question to you first, Fiona, can you tell us maybe some advice that what employers should be doing to protect and promote mental health and well-being, and what examples perhaps might have worked in workplaces within where your members work?
Yeah, absolutely. Well, I mean, I think it's really important what Robert was saying about one of the key things for improving mental health is to know that you have your employer behind you, and there is that sort of like safety net, I suppose. Unfortunately, again, that is so often not the case, and so I think one of the important things that employers can do is to be really forthcoming and explicit about how people are going to be supported. And again, I suppose this is wishful thinking, isn't it? Because the answer is for more employers to put employee well-being at their core, rather than say, profit margins or the whims of upper management and all that sort of stuff. But I would like to see things like employers coming out and stating that we are completely suspending the concept of attendance management at the moment. Any COVID related, I mean, it's like something that we were able to secure and we fought very hard for in PCS, was that COVID related directly to having the virus, absences would not count towards any sort of attendance management or disciplinary, but also something that we've been pushing for and we haven't managed to have movement on, although something that would be well worth putting to individual managers if you are representing someone who is facing disciplinary hearings for attendance management, is that mental health and stress related absences relating to COVID panic, relating to isolation, relating to all of the sort of the excess stress and bizarre new things that we're having to face, should also be discounted. And while this pandemic is going on, while restrictions are on, that people should not be at risk of losing their jobs because of lessened attendance as a result of that, while they're trying to do their best. I think also, and as I see someone in the chat has mentioned something about risk assessments as well, I think it's incredibly important that we have mental health focused risk assessments, or that it is carefully and well structured, built into risk assessments. People shouldn't be left in isolation. There should be appropriate management contact, but it shouldn't be overbearing. People should know that they are supported and offered that support, but also that there shouldn't be that intrusion. One of the things that I was speaking to a colleague who sits on the PCS Health and Safety subcommittee of the NEC, one of the things that he was saying about was that they found very effective in the Ministry of Defence where he works, is having a culture whereby when you have the risk assessment put in place for an individual with mental health issues, particularly when looking at going back into the workplace for COVID, but across the board, is that there doesn't need to be an overly explicit written explanation of exactly what is, what mental health problems someone is suffering from. It is enough to, because I think sometimes there is a tendency to to think that it's okay to just sort of express to pass that on, to have it all out in the open. And of course, it's incredibly individual. Mental health things can't just be like broad brush. While it is a collective bargaining thing for us to do, then it needs to be individually tailored to people, and at all times needs to be about protecting people's privacy, protecting people's dignity, and things like reasonable adjustments being put in place in risk assessments not needing to be explained, not needing to be so carefully proven and have to almost drag out the trauma that someone's experiencing or the difficulties that someone's experiencing to justify to someone that those reasonable adjustments are actually there in place. And I think that there needs to be something that we can all do as well. The campaigning on mental health is understanding that it's not as easy to just say, oh, I can't work because I have depression and I am suffering from that today, as it is perhaps to say I have a stomach bug or I have sciatica, and that we lack the shorthand, because my manager maybe just doesn't need to understand exactly what my depression is like today. They don't need to understand where my fatigue is coming from today. They just need to understand that I've judged that I can't come into work, or I've judged that it's not safe for me to work at the moment, or any of those kind of things. I see someone that has just said you need a good manager to back you too, and that is exactly, this is why we need to have key policies at the top, and they need to, I think upper management need to carefully monitor whether they're being applied further down, because there is so much scope for discrepancy between individual managers.
Thanks, Fiona. And we will be coming back to these issues around mental health and risk assessments and mental health as an organising issue. But first, I'm going to put that same question to Robert about what employers should be doing to protect and promote mental health and wellbeing.
Well, Fiona's obviously covered many of the points, but the one thing I would say is that they have a basic responsibility under health and safety legislation to manage all hazards, and does include mental health and stress, like any other physical problem. And that really underpins everything. That must be the starting point. I think there's a danger sometimes that employers do silo mental health, say, well, this is a mental health issue. Well, really, to be honest, often the best way of managing mental health is to be a good employer, because if you feel confident that your employer is supporting you, if you feel confident that your employer is doing all they can to manage your workloads, that is going to all help your mental health. So that to me would be the starting point. You can then perhaps develop on that, and I agree with the issues that Fiona said, issues such as reasonable adjustments, so that if employers do have mental health problems, that the reasonable adjustments you would, for example, apply to a physical disability could be as easily applied to a mental health issue. So I think that is important, but my starting point is always go back to the basis. And I also have to say that during this pandemic, pay has become in itself a mental health issue. When we have the people we depend on, some of the people we depend on most during this pandemic, workers in the social care sector, not knowing whether they're going to be paid the next day, how is that helping your mental health? And clearly both government and employers are failing those staff.
Yeah, absolutely, Robert. Both you and Fiona have mentioned that this is part of a bigger, wider societal thing. And I think we've seen mentioned lots recently is that coronavirus has brought up a lot of issues that perhaps were being ignored by many, or just not noticed or brushed aside. And they're now lying on the doormat, so we can't really ignore them. Okay, my next question I'm going to put to you first, Robert. So do you have any advice for workplace reps on how mental health can be incorporated into workplace risk assessments?
Yeah, I mean, I mentioned before during my presentation, a short presentation, the stress management standards, and I might try and actually just see if I can share screen. I can bring up a slide, hopefully. Can you see that?
Not yet. Have you clicked
okay.
the little... I'll tell you what, Robert, don't. If you can send it to us, we'll make sure it's sent out to everyone.
That's fine.
Yeah.
Okay. Hang on. I think actually I need to check that. No, it's not playing. Okay. No. Let me say, I think if you look at that, I think that will help, because we use that as a starting point for negotiations on stress and mental health. That is our starting point. We have done a mental health stress toolkit. We've done a mental health bargaining guide, which again mentions all the policies you may need to look at that influence mental health, which goes back to the point I was saying. Mental health is all about good management. For example, you have good sickness absence policies that is going to support staff in mental health issues. So they're all interrelated, but from our starting point has been the stress management standards. And as I mentioned, some of our branches have used that to good effect. So it isn't just theory, it's real practice where branches have used that. They said, look, these are your duties under health and safety law. These are what you're expected to do. And if it's a half decent employer, they will listen. Say in some cases, they've gone further than that and they've instigated action which are forced employers to take action by threatening, for example, to report them to the HSE. I have to say the performance from the HSE does not give you great, during this pandemic, does not give you great confidence in that one, I have to say at the moment, but nevertheless, it still is an avenue you have. So that would be my starting point. Look at what the law says and look at employers are expected to do. Look at the collective issues, look at the bargaining issues. That's the starting point, I think.
Thanks so much, Robert. And we will make sure that the slide that he mentions gets sent out to you all because we couldn't share it on the screen. So Fiona, same thing to you really. Have you got any advice about incorporating mental health into workplace risk assessments, and maybe ones that Robert hasn't already touched on?
Sure, yeah. I mean, obviously most of the things that Robert has said or I agree with all of them. The one thing that I suppose I would say just in addition is attempting to try to get any templates for mental health risk assessments or risk assessments in general, obviously agreed with the union and having input with the union and having those templates agreed in that way. Because, and also like, and I'm not one for going to the employer and saying, oh, look, the union's okay because it helps you too, because it's more about, I care more about what's helpful to the workers, but it sometimes is a useful negotiating tool because you can say to them like, look, if we have a strong mental health risk assessment put in place, we should be aiming here to maintain good mental health across the entirety of this workforce. We shouldn't just be aiming to firefight in individual positions where someone has very bad mental health or where someone needs a lot of support. And it's a bit like what Robert said there, like there are lots of things that employers can do to not exacerbate people's poor mental health and to help sort of like create a springboard for people to heal as well. And if there is something there that can be agreed by the trade union as a template, incorporating things like making it bespoke, making it sensitive to what people actually need, making it sensitive to the idea as well that maybe there isn't something that an individual person with a mental health issue can directly point to that is a trigger and can directly point to that will make it better. Sometimes there needs to be that flexibility that sometimes triggers will be different. Sometimes what will improve that situation will be different. And I think trying to incorporate a level of compassion and flexibility into those risk assessments, while also providing like a firm framework of how to help and what to support while listening to that person, but to listen to them and have it be, have that personal input. Because, as I said earlier, it can't be, mental health is not generic. People's like experiences with mental health is not generic, and therefore what would reduce their risk of negative impact to their mental health won't be generic either. So I think early on, lots of trade union consultation, and again, obviously that is slightly sometimes wishful thinking, isn't it? But it should be something that we're pushing for, to make sure that across the board the object is good mental health for as good as possible for everyone, rather than firefighting once problems have happened.
Yeah, absolutely. And that leads really nicely into the last question that I've got before we take some of the questions that the audience have posted. You've both mentioned how good mental health is a collective issue, but it has to be, there's not one size fits all, it has to be dealt with on an individual basis. But so my final question, as I said, is as people experience mental health very differently, and it is often seen as an individual issue in the workplace, what tips have you got of how we can collectivise it and use it as an organising issue to get members interested and even recruit more members to join us? So Robert, we'll start with you, please.
I don't want to sound like we called it, but I do go back to those collective duties employers have under health and safety law, and I think that is a starting point. But I also think I think there is a danger sometimes with health and safety nerds such as myself, and I use that phrase, is that we jargonise it. And the thing about mental health, it touches on everyday issues, and I think this is the real key to it. It's not. In a way, I was guilty of myself using words such as stress management standards, etc. You know, for workers concerned, you know, they're concerned about their workload, they're concerned about their home balance, they're concerned about their loneliness and isolation. So to use terms like that, to use issues like that, to involve members in the trade union movement, I often think that these sort of issues are like the soft side of organising. They are a very good way of getting people involved in the trade union movement. For example, it's sometimes very daunting and very intimidating that the first case you have would be a major pay claim, which can be very complex. And but everyone knows what their mental health issues are affecting them. So think of it from a personal point of view, how it affects you, how is it going to affect my colleague, and use language that appeals to them. And then you can use that again, then using some of the policies and ideas I talked about to galvanise and organise them.
Yeah, thanks, Robert. I think we're all guilty of using jargon at times, aren't we? Especially in the trade union world. It's full of acronyms and all sorts. But yeah, absolutely. Everyday language always helps. Fiona, what about you? Have you got any tips for how to organise around mental health?
Yeah, I mean, so it's interesting that Robert mentions about the language there and jargon, because I think that's really important as well. And I think that we as a society, but also, you know, as a trade union and as a labour movement can sort of lead on this, is trying to develop language or understanding that is accessible to everyone about what's actually wrong. Because, you know, again, as someone who, I have mental health problems myself, and I know that, and it is incredibly widespread, sometimes it isn't actually that accessible to even be able to communicate like what the problem is, partly because I think, you know, society, we're only just taking the baby steps over the last, you know, maybe 5 years or so even, about it really becoming part of collective consciousness. So I think if society is telling us we're making it up, so how do we even explain it? And I think it's something the labour movement can do, is can sort of really take the lead on talking about these things, and not just in terms of, and things like stress management standards were incredibly useful for when you're going toe to toe with the employer, absolutely. But when communicating with members, things like even just campaigning around feelings like sadness, and I know, and this does sound soft, and I can feel myself even being like, oh, is that real trade unionism? But things like sadness, loneliness, frustration, anger, all of these things which impact people, which are seen as, you know, anxiety as well, and fear of the future, not good enough reasons to like not go to work, or not good enough reasons to impact you. But they're, you know, they're basic human emotions that govern everything that we do. And so I think trying to humanize it, as Robert has said, and trying to sort of like collectivize around that humanity of it. But also, I think using the hard side of trade unionism as well, things like pay, as Robert said earlier, like, you know, if you're basically being given poverty wages, and your rent's going up, and the price of groceries going up, and your kids' like school clothes, the price of that's all going up, and your wages staying the same or going down and stagnating, then how are you not speaking? Like, how are you not feeling worried all the time? How are you sleeping at night when you're not entirely sure whether you're going to have enough for the shopping at the end of the week? And organizing around those things, and weaving in mental health to that as well, like pensions, campaigning on pensions, important for lots of reasons, one of them being mental health. Talk about how mental health impacts people who have retired. Then things like the menopause, campaigning on menopause within our workplaces, and provisions for people going through the menopause. How does that how does mental health pull into that? Young members, how does mental health impact them? And sort of weaving it in even into things like pay campaigns, and the more like high level health and safety, or whatever campaigns that we can sometimes have on trade unionism, because it is important. And because if we don't have a healthy workforce, and therefore if we don't have like, you know, a healthy body, like trade union body, the rest of it can easily fall by the wayside. And so I think by sort of presenting like a strong industrial solidarity based, like collective worker led challenge where we all pull together on these issues, and that includes mental health, and that includes, you know, like the softer side of things, because that can so often get put by the wayside. And I think that by winning in those areas and demonstrating strength, and not just humble petition to the employer to please help us, but in the strength of our members standing together unified, which is obviously the underpinning of everything we do here, we have the confidence and the opportunity to demand better. And that can be from pay, or, you know, terms and conditions, or things like mental health, decent provision for people who need time off for mental health, and all of that sort of stuff. So yeah, I mean, as someone here has just said, like a joined up approach, and that's at the core of everything. I believe is that particularly across like the TUC, we need to have joined up campaigning on all of these things, unions working together, because when we stand together as individuals within our union, we're stronger, and when we stand together as unions within the wider society, we're even stronger again.
Yeah, absolutely. You've both made some really, really interesting and important points about how mental health touches across all organising aspects, really. I just want to highlight a couple of the comments that have been posted in the chat and on the questions that link to what you've both just been saying. A viewer has sort of suggested that given the magnitude of mental health issues generally, and particularly that have come to the forefront throughout coronavirus, is sort of the emphasis on mental health in the workplace, and even the idea of mental health workplace reps. Is this something we could support and promote across all trade unions? Maybe that's something that you don't think would be practical. It would be interested to hear your thoughts, because whether it should be a separate thing or whether it should be part of the regular safety reps role. We'll go back to you first, Robert, please, on that point.
Yeah, it's a very good question, and I know that you know, we've had some stewards who have specialised in mental health work. I must admit, I would prefer to still see as part of the safety reps role. And one of the reasons for that is that safety reps, maybe this is something I should have said earlier, safety reps have unique powers and rights under UK law. They have rights to be consulted, they have rights to time off, which go beyond that of a steward. Actually, many of our stewards dual register as a safety rep for exactly that reason. The other point I would make is I don't think there's any reason why a safety rep cannot specialise in mental health issues. It depends on the strength of that branch, and it depends on the resources you've got available, to be honest. But and the point I made was we've had a big campaign in UNISON to increase the number of safety reps in our membership. We see it as a really important organising tool. And one of the issues I make there is you don't have to be a health and safety expert in everything to be a safety rep. I say your basic duty as a safety rep is the ability to listen, the ability to know of the everyday issues that affect your workplace, and make those representations to your employers and managers, speak to you and express the concerns of your members to managers. That's your job. Your job isn't to manage health and safety, that's your employer's job. Your job is to represent the interest of your members. And most people, when they think about it, if they just think about it, can do that very well, because they know what the issues are affecting their workplace. And I would say the same there applies to mental health issues. There is a danger that we mystify it, that we somehow say you've got to be an expert in mental health, and you don't. We all are experts in mental health. We all, say each of us knows, for example, the mental health issues that have affected all of us in some way or other during this pandemic. In some cases, those being workers going into work unsure about their safety, and which is going to have a huge impact on their mental health. In other cases, and that's probably like myself and Fiona, where we've been working home, there's a strain of being isolated from colleagues, for example. We all know about that. We don't have to read a a PhD document on it to understand it. We understand that. And that's where perhaps I think we should be careful about mystifying this issue. It is still about the basics of good trade unionism and good management. And I think that's what we need to focus on most.
Yeah, absolutely. Thank you, Robert. And I just want to highlight a couple of the things that you said there about reps' daily activities before I ask Fiona the same question. Is the reps' key duties? I said are listening to their members, listening to their colleagues' concerns, and representing them to management. Like you said, not an expert on health and safety itself, but listening to the people that they work with, perhaps surveying them as well, if it's a massive workforce, and working with their fellow reps to make those representations to management. So Fiona, do you have anything to add on top of what Robert says about this idea of mental health reps in the workplace? And then I'll take another question from the audience.
Yes, I mean, I've seen a couple of things in the chat as well, talking about mental health first aiders and stuff. And I guess just first and foremost, just the work that mental health first aiders put in, and reps who are perhaps more, pick up more mental health based work, incredible. And I have such respect for the work that mental health first aiders do within their workplaces. However, one thing that we have seen within the civil service is definitely a lack of support and for those mental health first aiders when they're set up by the employer. Oh, you're a mental health first aider now, on you go. And people will be putting in an awful lot of effort and energy in doing an incredible job, but doing that off their own back and potentially to the detriment of their own health and safety and well-being. And where's the backup there? So I would be keen to see mental health be something that is incorporated probably into the part of the health and safety rep. I saw a great comment by someone called Linda in the comments saying sometimes we focus a lot on the safety and we maybe forget about the health part of the health and safety rep. And obviously this is an incredibly, it's a really holistic role. So I mean, I would like it to be joined up. I also think that it's something that there would maybe be the risk of it being working in silos there, where we then don't weave health and safety, mental health training into the other aspects of rep training. Because of course, I think all reps on this call probably recognise that often there might be an issue that you're representing on someone, and mental health is a part of that, but it's not the whole part of it, but it comes in. So I think all reps will be coming up against mental health as an issue interwoven into other things that they're representing people on as well. So I think it's really important for it to be interwoven. I'd like to see increased training rather than necessarily a new specific role, but I can't see why people who have a specific interest in campaigning and pushing forward on that wouldn't be able to and should be supported within your branches. That's something that you can manage and support yourself.
Yeah, thanks, Fiona. I really like that idea of it should be interwoven into everything really that a rep does, rather than being a kind of siloed separate issue. That doesn't mean it can't be emphasised, but it's part of everything, isn't it? Okay, I've got a couple of questions I'm actually just going to put to the audience before the next question for you. And they've both been posted in the Ask a Question area. They're just general, so don't feel you have to answer this, but just get a general idea. Someone has said, my employer doesn't have a mental health in the workplace policy. Is that unusual? I'm curious as to what our audience think. Is this an unusual situation? And someone else has also said, does anybody have any good examples of working from home or agile working policies that they can share? Now, we're not expecting you to share a fully detailed policy. If you do feel able to share, please redact if you don't want to share that publicly. But we are, someone has asked if you do have one that you are able to share, please link to it, or if you can't link it, send it to us and we'll kind of anonymize it and we can include it as resources. It looks like my first question about whether people have a mental health policy is not unusual. The majority of the audience seem to be agreeing. Someone's just saying they do have one. Really interesting. But lots of people were saying they haven't. So yeah, keep your answers coming. But I am going to put another question now to Robert and Fiona. So where were we? Okay, so I think a really key point here, how can the rep team who are listening to other staff, maybe taking a lot on themselves, how can they be supported in their role? Because they perhaps take on more of a burden than their colleagues. So Robert, we'll start with you.
Yeah, that's a very good question, and it's an issue that has been raised at UNISON conferences a number of times, where there's support. What support can we give to our own reps? And there isn't an easy answer to it. And I think one of the best ways of doing it, to be honest, we need to increase the number of reps we got, because the reality is, I think, I don't think our union is alone. I think when I've spoken to colleagues in other trade unions, they say our numbers of safety reps are now increasing, but that was after many years where they were falling, and there were various reasons for that. And the age demographic of the workplace, I think, is an issue. Too many of us in the trade union movement are near retirement age, and we do need to recruit more younger reps. And I think that is an important part of it, because otherwise, if we have the larger the rep base you have, the more we can spread that workload. Before I just finish, I just want to go back though on a previous point about mental health first aiders, if you don't mind, because that issue was debated. There was a very, very good debate at our 2019 Health and Safety Seminar. I don't know if you remember those good old days when we used to be able to meet in large groups of people. But yeah, there was it was during, and there was a very, very lively discussion and debate. And there is a concern. We say we don't use the word mental health first aiders as a trade union role. We do use the word mental health awareness. We have nothing against employers employing mental health first aiders, but I think there is dangers sometimes, certainly in the trade union role. For example, we've had examples of reps suddenly being put in very difficult positions of supporting members who they believed were suicidal. And, our advice was there to really get support from groups such as Samaritans, who have the expertise and skills to deal with an issue like that. So I just think we need to be a little bit careful on that issue. I think that's all I would like to say.
Yeah, absolutely. Some really important points there, Robert. And I don't know whether you've seen in the chat panel, there's been quite a bit of debate about mental health first aiders, and some of the issues that you've mentioned have been highlighted there as well. But so Fiona, the original question that I put to Robert about how reps who are perhaps talking to members more and taking on more can be supported in their role.
Yeah, well, I think, not to sound like a broken record here, but a lot of the time, a huge number of these issues falls down to the core principle of organising a body of power and solidarity within your membership to stand behind the rep players, because sometimes, and it's through no fault of the members themselves, because of things like government attacks on facility time, attacks on like the rights of a trade union to organise, and on balloting, and all of those kind of things. Reps end up having a huge amount of workload to do in very little time, when they're constantly being hounded for, you're certainly in the civil service, constantly getting hounded for what you're using your facility time for. Put it down in a finicky little spreadsheet and have to account for it all the time, and you better not be using it for anything that could not be construed to be benefiting us, as well as all of those kind of things. So like shifting and towards and really trying to push towards a system of union organising where it is about empowering members to take action themselves, supported by reps, and perhaps obviously led by reps, but very much where everyone is playing a part of taking that the sort of organising power and the momentum forward themselves. So that we don't have a situation where reps are having to do everything. Reps are, burning out as well, and where it is just sort of a few people trying to hold back the tide of the employer putting all of this stuff onto people. I also do think, though, that just like there needs to be national and regional union support. Whatever way that your union is structured, there needs to be the regional and national support for people who do find themselves in positions of incredibly serious trust and vulnerability that members often are forced by the employer to display to their trade union rep, which they might not want to. They might not have wanted to do that, and so and the reps have to be in a position there to be able to sensitively handle it, which is why I think that formalizing mental health training is really great, and obviously that I'd like to see that incorporated into all rep roles, so that there is a process for what to do when this happens, rather than having to just hope that you come up with the right thing to say at the time, because that's a huge amount of pressure to put on someone.
Yeah, thanks, Fiona. I think we've got time just for one more question. I'm just going to put to you both. It's been our most popular question today, that has been voted for by the audience. So just to, it sounds like this question has perhaps come from someone in a frontline role throughout the pandemic. They're saying, in their workplace, we're dealing with a lot of colleagues who are feeling fed up and burnt out. Their organisation has been very supportive, but they've been working throughout, and staff have been working at emergency response level since lockdown 1. And as we all know, we're now in lockdown 3, and they're tired. How can we support staff feeling this way? And what could the organisation do to help, bearing in mind that they're perhaps in an emergency situation? So as I'm aware, time is ticking by. Perhaps, Robert, you could just give us two things: one that the rep can do to support them, and one that the organisation could do, and then the same for you, Fiona, because as interesting as it is, I'm aware that we're nearly at 3:00. So, Robert.
Right, very quickly, from the rep point of view, I think the most important thing you as a rep can do is to say, I'm here, I'm there to support you. That is, to be honest, that is the most important thing you can do, and the most helpful. And from the employer, I go back to it's about good management. It's about listening to what your employers say. I think our members know that these are exceptional times, and they have really, they've really stood up to the mark. I think they have been incredible. So I think they know these are exceptional times, but they want to know their employer is there to support them. And I'm going to make a little thing here that we were asked to clap for carers as well. I would like to finish by saying, how about getting them a decent pay rise?
Absolutely, Robert. And what a good note to finish on from you. Fiona, have you got one piece of advice for reps supporting their members in this situation, and one thing that the organisation can do?
Yeah, I think just in addition to what Robert said about being there and being able to offer that help and support, I would say an important role for a rep is to encourage that person to feel confident and acknowledge what they're going through. We might not be able to actually change, particularly for someone working in frontline emergency, we can't necessarily change the fact that you have a huge workload, an incredibly dangerous thing to be doing, but we can acknowledge that that is something that you are doing, and that you deserve support for it, and you deserve to be well paid, as Robert has said, and that we'll do everything we can to support you in it. And the employers, yeah, absolutely, pay your staff a wage that means that they are not worrying, in addition to maybe having like depression and anxiety, whether they can pay for things. Have terms and conditions that are designed to support staff to do their best work, rather than to trip them up at every opportunity. And yeah, to quite literally put your money where your mouth is. And if someone is doing a good, and to recognize that you need those workers. There is nothing that you as an employer or a company have that you don't have off the back of your workforce, and workers should recognize that, and the employer should recognize that too.
Absolutely. Thank you, Fiona. So we've been on air for very nearly an hour, but I think we could all agree that it's been incredibly informative and really helpful. I think you can see the chat sort of zooming by, everyone saying lots to think about, and thank you both for your informative words. So it all remains for me to thank you all for attending. We will be sending a recording of the webinar to you all if you've registered later today, along with any links that we've posted to blogs or information from UNISON and from PCS, also any TUC advice that we've got on this. Our next webinar is in a few weeks. I think it's in 2 weeks. I might be wrong there, but it's on the bit of a different subject for us, but very important. It's on GDPR, something we all need to be aware of in our reps role. So do tune in for that, and have a good rest of the week. Thank you everyone for joining. Bye bye.